grew up in Illinois and went to school at the University of Illinois for both medical school and undergraduate and some graduate school. I did my residency and fellowship in Galveston, Texas, and I worked for a little while in Tennessee before I came here, and worked in academics and decided I wanted to go into private practice, and this was a good fit. I've always enjoyed science. I was interested in science since I was a little kid. I enjoy working with people. I'd much rather be working with people than working in a lab, and so it was a natural area to gravitate towards, I think. During medical school, everyone does a rotation in OB-GYN, and that was my favorite rotation by far, so I decided to do a residency in OB. As a resident, I gravitated much more strongly towards the obstetric part of the residency, and decided that I wanted to subspecialize. Maternal-fetal medicine, or MFM, is also called perinatology, is the subspecialty that I work in, and essentially it's taking care of high-risk pregnancies. Some of them are high risk because of maternal disease, some of them are high risk because of risk factors for having pregnancy complications, and some of them are high risk because of problems with the baby or issues with the baby. Patients who have difficult pregnancies oftentimes need a lot of support during the pregnancy, and it's rewarding to take care of them. It's rewarding to help them get the best outcome that they can. For exercise, I like to swim most mornings, and I have several horses, two of which I compete, one of which I compete in dressage and the other one I compete in eventing. I'm married and I have two daughters. We live on a farm out in the country, about half an hour from Richmond, and we have a bit of a menagerie at our farm. We have horses, cows, goats, chickens, dogs. They may come to me for an ultrasound, and then once the ultrasound is done, they'll have their regular visit with their doctor who's taking primary care of their pregnancy, and we work together as a team to try to come up with the best plan to have a good outcome. A successful day is when one of the patients who we've taken care of who's had a good outcome comes in to show us the baby, and then we can see exactly what we helped bring into the world.